Welcome back to the Inside Athletic Training Podcast. Today we're joined by Dr. Jeff Konin, an NATA Hall of Famer, author, educator, and leading expert on cannabis as it relates to sports medicine, performance, and recovery. Dr. Konin joins us for a wide-ranging conversation on cannabis and sports, and the most important things athletic trainers need to know in this rapidly evolving space. Enjoy the show. All right, Jeff, welcome to the Inside Athletic Training Podcast. Super excited to have you on for the show today. Clearly someone who doesn't need an introduction, NATA Hall of Famer, author, professor, founder of the International Cannabis and Sports Academy. Really looking forward to your insights about all things cannabis, sports, performance today. To start us off, you've spent over 3 decades in sports medicine, truly extremely experienced at so many levels. What first drew you into the field of sports medicine, and how has that kind of, shaped what you're doing today?
Well, first of all, thanks for having me. I'm excited to be here with you, and this may not be such an exciting answer for you how I got into the field, but it was default. I always wanted to be in medicine, but I didn't have the grades for it. And it was 30-something years ago. Being an athletic training student, quote unquote, was really a work study job when I was in college. And so I had the chance to, work in the trenches as a student and probably do things and make decisions that we'd cringe about today that someone allowed me the opportunity to do back then when I knew nothing. But that grew into, the opportunity to be mentored by some great people to put me on that pathway. And so, some 37 years later, here I am today.
Yeah, that's a familiar place that many people start, in the trenches, as you mentioned, doing things maybe they shouldn't necessarily be doing, not in a bad way, just inexperience. You've worked with youth sports up to the Olympics, seemingly so many different avenues that you've seen. Are there any specific sports or experiences that shaped kind of just your career in athletic training and sports medicine specifically?
I think the generic answer is everyone will tell you that every experience helps shape you. But I think you'll have to look back on it. I had the opportunity to spend a couple of years with Team USA wheelchair rugby, who is affectionately known as Murder Ball. In fact, many of the coach and many of the key players come from your area, neck of the woods in Austin, Texas.
Okay.
And I never really worked much with Paralympic athletes, let alone to begin at the Olympic level. And so that was eye-awakening for me. I came to realize that, like every other sport at every other age, there's this bell-shaped curve of people. And they're just like everybody else. They just had a physical disability. It was an incredible experience to watch them persevere at those levels, work harder than probably any other athletes I've ever worked with because they didn't have a choice. They did a sport with a physical disability, but that might have only been a couple hours a day. The rest of the day, they still had a physical disability that they had to, maneuver through, whether it was taking a wheelchair to work or lifting up kids at home, whatever it was. And so those guys and girls were really a motivational factor to me to almost give me another boost in my career at that point of life. And still to this day, many of us remain great friends. We traveled around the world together. They taught me an awful lot, just about working with people, like, as I said, with any other age population or sport, quite frankly.
Yeah, that's awesome. And that's one actually area that PBATS has gotten involved in is, sports and people with disabilities as part of our Ability Transcends Challenges program. I think baseball has been a sport where if you can play, you can play. You're going to be given the opportunity from Jim Abbott, Curtis Pride, really cool stuff there. To kind of interested to hear you talk about that. Well, Jeff, one other thing before we get into the big topic of the day of cannabis and sports medicine, your expertise there, kind of a leader in the field, being a professor, we just spoke offline. You've taught many of our PBATS members, from Joe Benj with the Tampa Bay Rays, Corey Tremble with the Miami Marlins, many people who have had a ton of success in baseball sports medicine. What do you like about being an educator? What drew you to that? And what keeps you going in the professor world these days?
Wow, that's a great question. I think everyone will probably tell you we love helping others, mentoring others, teaching others. What drew me to being a professor, honestly, is the quality of life.
Okay.
I was a clinician for many, many years, and as I said earlier, the grades in school weren't my strength. So the fact that I'm a professor is actually humorous.
Sure.
But at some point in time, many people in this crazy profession realize that you're away from home, you're missing opportunities with your family, your wife, your children, those kind of things.
Right.
And I slowly migrated away from the clinical side into the academic and teaching and research side, and it's where I find myself today mostly. But it affords the flexibility of a greater quality of life. And I think, between you and me, this is a young person's sport. It requires long hours, requires still some physicality to do the job. And we're all motivated when we're young to do that. We want to reach the heights of professional baseball and others.
Hmm.
And then at a certain point in time, everybody realizes, like everything else, you go through phases of life. And I hit that phase of life. I was very fortunate. I had a chance to work in the Olympic Games at a young age. I had a chance to do some other amazing clinical things early. And so there really wasn't a bucket list. And the bucket list was, how am I going to enjoy still doing and staying in touch with what I do, but having a better quality of life, if you will. And that's how I shifted over there. And fortunately, my clinical experiences helped me maneuver myself into the classroom as a professor.
Yeah, that's great. And obviously, like you said, being on the road for 80 plus days and the stuff we hear from people on our show who are PBATS members, it really, you do miss a lot. So it's a point we hear from quite a few people in the field. Well, Jeff, big topic of the day, cannabis and sports medicine. You're definitely a leading expert in that field. I think it's very unique and changing very quickly throughout all sports and leagues. What specifically led you into learning about that, studying, advising, all things cannabis and sports medicine?
I think there's a couple of pieces that took me down this pathway. One was the mere fact that as an athletic trainer in a collegiate setting for many years, I became very frustrated with the entire drug testing process.
Mm,
Like most would tell you, we are the individuals, even though this may be considered a compliance issue, it was passed on to the athletic trainers. And so
right.
we're the people getting up in the morning, watching individuals urinate into a cup. We were the ones overseeing the budget. We were the ones dealing with mass tests or pulling people in with positive tests. We were the ones enforcing the policies. And quite frankly, they weren't very effective. And the policies would change over time depending on who would test positive, whether we would enforce those guidelines or
Sure.
not. And, it's borderlining ethical situations there that we were put in the middle of. But the second part of it, aside from that, because I think all of us can say they face that, but not everyone else decided to take a pathway down learning more about cannabis.
Hmm.
But I started interacting with individuals around the country, mainly from the West Coast, where, as you're probably aware, this is more openly accessible and acceptable, where it
Sure.
really started in many of the states. And people were saying that they were using recreationally, self-dosing on their own, various forms of cannabis or marijuana, and it was helping them sleep, and it was helping with their anxiety, and it was helping them with pain relief and things of that nature. And so I just got really curious because our messaging forever to our athletes of all ages in sports was cannabis is bad. Don't do it.
Right. Right.
And so I really questioned the fact, was our messaging accurate? And so I started looking into this and saying, A, is cannabis bad? And then B, if it's bad, define bad. Because the message of don't do it, stay away from it, we're going to punish you was a failed message over
Hmm.
decades. And what I started realizing was in collaborating with others, that is very, very interesting. And we were sort of crossing drug testing scores with various performance metrics, ranging from lean body mass growth to reaction times to sleep patterns. And we started realizing that not everybody falls into the trap of I use cannabis and something bad happens. Some people tolerate it better than others, quite frankly. But the truth of
Hmm.
the matter is, the majority of the people, when they use a small amount, tolerate it just fine, just like a small amount of alcohol. But once they go past a certain amount, the body changes. How the body reacts changes. And that's where they start to see impairments in their performance. And as we looked into that deeper, we could identify the different sport impairments and in some cases by position impairments,
Okay.
right? So in baseball, really simple fact. If somebody grows up and they use cannabis on a regular basis, maybe they become more accommodated to it and they can use a little bit, and it's not going to alter some things. However, take a little bit more than whatever that dosage for that person, and they start to see impairments. So their reaction time decreases. What does that mean? Well, in baseball, if your reaction time is off, good luck being a successful hitter.
Yeah.
If reaction time is off, your first step, stealing first to second, your first step off the hit bat. So a number of different things come into play where we were now be able to educate individuals with very specific circumstances. And then the reality came into play when those people using cannabis started seeing those situations occur and saying, hey, this guy's not crazy. He's
Right.
absolutely right because I'm losing the ball in the lights. My first step, I'm getting thrown out second base more than I should be.
Mhm.
Maybe I need to back off this a little bit.
All very interesting. And in the basic form, I do want to get into, when we say cannabis in a clinical or sports setting, what are we talking about? Are we talking about, we're going to get into performance, recovery, pain management, but when you say in a sports setting, are we talking about during the active performance? What are like the main areas, cannabis in sports that you talk about?
Yeah, that's a loaded question, right?
Sure.
That's a 30-minute response. Because what I've found just in my situation alone too, but not with others, one of the things we all lack is the knowledge, the education.
Right.
It's because for decades it was easy. Well, don't use it, you can't use it. We didn't really have to know much about it. So if you think about it this way, cannabis is the plant that comes out of the ground. And inside the plant, it has multiple components of which are referred to as cannabinoids. And if you think of this like a vitamin, there's a multivitamin, but within the multivitamin, it has vitamin A, vitamin C, vitamin D, and so forth. Majority of the cannabinoids are unknown to the average person, and to those that even study it, unknown what they do. Ones that we are aware of, for example, THC, CBD, and a
Hmm.
few other more commonly known ones.
Right.
So when we talk about these specific cannabinoids, the question really comes down to like everything else we do. Why are you looking to take this? Is it because you're in pain? Is it because you can't sleep? Is it because you're anxious? And then based on that, which cannabinoid that has a different function would be the most effective for you and in what dose and in what type of format or application. So going back to the vitamin example, if you told me that you are having repetitive stress fractures and your bone density is low, well, we don't recommend vitamin C because it's for a different function. We recommend vitamin D, which assists with bone density. And
Got it.
so we try to match the rationale with the appropriate cannabinoid in dosing. And it's really quite simple, but the average person, including the average clinician at the highest level, really doesn't know this. And it's nothing more than a couple minute presentation to
Yeah.
get you up to speed. I don't know, it's not a secret that I have. My goal is to educate others so that they're aware of how this operates.
Yeah, that's great. I think that's super clear there, that answer about the function. I don't think a lot of people view cannabis as, there's a function for different parts of it. I think that's super helpful, you explaining that there, even though it is extremely basic for someone at your level. When we dive into that a little more, talk about in your experience, like the biggest misconception. So you talk about, hey, it's bad, don't touch it, we can't use it. Things have developed. Among athletic trainers working with athletes, because that, primarily our audience here, biggest misconceptions when you get in a room and you talk to someone about just cannabis in sports and their athletes or even themselves using it, what's the misinformation you see most?
I think the most common misconception is simply dosing.
Okay.
Because with any condition anybody has, when it's monitored by somebody on a medical staff, they can give you some sound advice as to what to take, when to take, how much to take. But in this particular situation, athletes, it's been taboo for the longest period of time. So they're not necessarily comfortable to talking even to trusted people within the organization. And
Hmm.
so the athletes will self-dose. And when they self-dose, they don't realize that you need to stop at some point. And so they assume, well, if this works, then the more I can take, the better it's going to be. And well, I've been doing this forever. But what happens is it's not just the acute phase. So the acute phase is the obvious, right? So if I sit here and somebody either rolls me a joint or puts some marijuana inside a vape pen, that if I take it in and inhale it right now, I'll get those effects. I'll feel totally different. I shouldn't get behind the
Yeah.
wheel. I certainly shouldn't go on the baseball field. That's the obvious. The not so obvious and misconception is that, well, once it's out of my system after I'm quote unquote euphoric or high, everything's good. The reality is the remaining components or byproducts of the cannabis stay in your body for a longer period of time and impact your body over that time. Very different than alcohol. You can drink alcohol and have that acute effect where I shouldn't get behind the wheel and I shouldn't do certain things that are risky. But the next day, what's the worst case scenario if you drank too much alcohol? You have a hangover, you may be thrown up, you just don't feel
Yeah.
so great. But then 2 days later, it's gone and it's fine. That's the difference between this, because the misconception is that once I stop smoking it or taking it in whatever format I use, then my body's fine after that. And the reality is, this is why when we would drug test, if you think about it, if I drug test, it's only a snapshot of whatever's in your system at that point in time when I took the test. So what relevance does a high number have in a positive drug test if the last time you smoked was 3 weeks ago? It has significant relevance, and that's what we've learned now, is that when it's still remaining in your system, it has the ability to impair different components of your functioning.
Interesting. And when you're working with, high level athletes or athletic trainers, and we get into kind of the performance side of things here, you talk about dosing being the most important thing. What does that look like in terms of figuring out, analyzing, using data to uncover what's a good dose for me, what's a good dose for you, what's a good dose to use during performance? Like in basic form, I know, again, you're the expert. This could be an hour-long conversation about that question. In basic form, what does that look like for you guys?
No, Sam, actually, that's an easy one because I have no idea. Nobody knows. The truth of the matter is.
Gotcha.
So if you have a migraine and I say, hey, Sam, go over here in this cabinet, I've got some ibuprofen in the jar. Go ahead and help yourself. Most people will go and take 2, maybe 3, at the most 4, but you never take 10 just because 10 is too much. And
Right.
you might have no idea what that means. If you take 10, what's it going to do to you? You just know it's too much, right? We don't have that same mentality, though, with cannabis. And the truth of the matter is, because the way it's scheduled at a federal level, which means Schedule 1, and there's discussions now about changing it from the medical side, but not the recreational side yet. But Schedule 1 means that it's a substance that provides the most harm with no benefit therapeutically. Marijuana and cannabis is in a category of heroin,
Yeah.
LSD, meth, right? Well, it's certainly not as dangerous as those. There's risk associated with use, but the reality is, in Schedule 1, we can't study it. We can't perform studies. So I have no idea what the optimal dose is. We can't do clinical trials. I tell people all the time, jokingly, that I can tell you exactly what it does to each of your players if you were to let me control the dosage and give everyone marijuana every day at practice for the next week. I can tell you exactly what it does to their system and how they perform, right? That's never going to happen at any level. And so the truth of the matter is, to answer your question maybe a little bit more scientifically, is that everybody has a certain amount in their system that the system tolerates before the impairments kick in, right? And so it's the same thing with alcohol. If a bunch of us were sitting around in a room and we passed out whatever it was, tequila shots, beers, it doesn't matter. People are going to have a different effect in our body after different amounts. We're all going to have a tolerance that's a different level. Our body's going to respond in different ways. This is the exact same thing that happens with marijuana. So it isn't a one size fits all. So the appropriate dosing for individuals to act therapeutically but not create impairments is different for every person. And that's why I'm not a big fan of what we call gotcha drug testing or random drug testing.
Yeah.
Because it gives you a number and there's an arbitrary threshold that says, okay, if it's over this amount, it's positive. But it could be, you could have an amount in your system significantly lower than a failed test, but still be impaired because your tolerance isn't there where it needs to be. And so everyone's different. And it's nice to educate people globally. Here's a whole team. Let me show you what it does. But it's going to do everything differently for each of you. And so we need to talk one-on-one to learn about your use, your patterns, your amount, your dosage. And let's compare all that to your performance metrics. And then I can tell you if you're at a dose that's too much or not. Does that make sense? I know it's complicated.
No, that makes great sense. And for the listeners out there and myself included, the inability to do the testing, like you mentioned, obviously a huge drawback. And it would be awesome to to learn about
Easy,
that,
easy.
and it sounds like you could do it, and you're unable, which is unfortunate. Maybe one day. But so along those same lines, Jeff, you hear about performance, which we kind of touched on briefly there, but recovery, pain management, sleep. I think those are three things I hear in the field about just being an athletic trainer, but also related to cannabis. So if you don't have the ability to do testing and dosing and figure out what's best for an individual player, how do you kind of present guidelines for like baseball recovery? Someone just threw a complete game, someone just a ton of workload. What do those guidelines come from if we don't have the exact data?
Yeah, they're again individual one-on-one
Okay.
conversations and communications. I will tell you this: a very popular coach years ago once said that I don't know that we really know the full impact of cannabis in athletic performance, but I'm pretty darn sure that you don't become a better ball player by using this. And there's some truth to that. And here's the reasons why. The system in the body that cannabis impacts on, whereby people say, yes, it helps me sleep better, recover better, et cetera, is a system of balance.
Okay.
It's not a system of ultra performance or, for example, like if you're using steroids or blood doping, those are performance enhancers that allow you to perform above and beyond what the body's capable of doing. The
Okay.
system in the body is called the endocannabinoid system. It doesn't allow for ultra. It allows for bringing the body back in balance. So, for example, inside your body, if there was a deficiency in a component of that system, let's say it was deficient in CBD. Well, how are you going to get CBD? You supplement it, just like if it was deficient in vitamin D, you supplement it. So the individual who finds benefit from either pain relief, improved sleep, decreased anxiety, improved recovery by using CBD is finding the improvement because their body has a deficiency. So it's helping them get back to where a baseline of where they should be, quite honestly.
Gotcha. Gotcha. And moving on from that, we a bit about recovery there. Pain management, I think, is one of the things you hear the most, whether that's NFL players in collision sports or any athlete at a high level or even at a mid level. When it comes to pain management and cannabis use, are there any? Of course, we talked about this being individualized a million times today, but what's your kind of expertise there in terms of maybe
Yeah.
timing or usage, or because you talked about staying in the system for pain management and high level athletes? What do you usually guide them on?
Yeah, so there's two components to that. So the first is that if you're using it for pain, we're under the assumption that you have an injury or an impairment or an illness of some kind. It's
Hmm.
being monitored by somebody on the medical staff.
Okay.
And then in collaboration with everyone, we talk about the appropriate, again, type of maybe THC that someone's using, dosage, proper way to take it in, et cetera. Right. The downside of this is that in most cases, it's not managed by somebody on staff. It's self-dosed to remove my own pain. And what we learn is that when I call it a marijuana overdose, a person's MO, right? Now, they're not overdose as in dying, but it's the 10 ibuprofen example. They're
Right.
just taking too much. Well, what we've learned is that related to tissue healing is delayed when there's too much THC in your system. So
Okay.
while you might be getting the benefits of pain relief, you're actually prolonging the recovery of your condition. It could be a hamstring strain that would normally take 5 days, that's now maybe taking 7, 8, 9, 10 days. It could be a concussion. It could be a stress fracture. And the challenge here is that when a person's self-dosing because of an injury and they have more downtime, they're typically more tempted to use more during that downtime. And while they may have pain relief, whatever it is we're treating is not showing functional improvement in the same timeline. And part of the reason that this is really critical to have open communication is A, obviously figure out an improved dosage, a lower dosage that's more appropriate, but B,
Mhm.
you talk about, say, the Corey Trumbles or Joe Benjes or the other guys that are in this position that each day and sometimes multiple times a day have to deliver an update to the coaching staff on this person's injury status. Well, if I've got an acute injury, someone just tweaked their hamstring, and I know that this is what we can do, and with our great staff, we can get them back in X amount of days. I deliver that report, and now those days go by, and that person's not better. And the coach is saying, well, what's
Yeah.
going on? How come you told me it was going to be this day? So this is where communication is helpful. A, to know if that person has something in their system, and B, to educate them that now that you have an injury, what you may have thought was fine, the amount you use, now might be too much because it's prolonging your ability to get back to that performance stage.
That's really interesting. I never even considered, the fact that cannabis or, can slow that recovery when, like you said, if you feel better and pain is relieved, a lot of times people might think, hey, this is good. So really interesting there. Well, Jeff, the one other component, obviously huge in terms of recovery and pain management, is sleep. I think this is one of the most common aspects of cannabis that people talk about within athletes, traveling east to west, 5 hour flight, landing at 4 in the morning, need to sleep, getting off schedule, all that stuff. Talk a bit about sleep in general. Cannabis, is it good for you? Should you do it? Does it affect your sleep? We've heard things about people stopping dosage after they're using it for a while and sleeping and messes up their sleep, all that stuff that you hear. What's your opinions on that?
Yeah, Sam, similar response. So if you're using it for sleep, it's a low dose.
Okay.
It's going to provide you the ability to relax and fall asleep and maybe have a better REM.
Okay.
However, if your dose is significantly higher, think about this, you'll still fall asleep the same way, but it's going to be in your system more acutely. So now when you actually wake up, you won't wake up with a good night's sleep. You're going to wake up more sluggish and fatigued and tired, reluctant to get out of bed, hit the snooze, miss the good team meal breakfast, now go through the drive-through of a McDonald's or a Chick-fil-A or something.
Yeah,
And nothing against them.
compounding.
I'm guilty of that at times as well.
Right.
But it's pattern light, and the pattern light is typically the most adverse when you have more in your system than you should. There's no doubt it helps. Now, if you're dealing with an injury of some kind, but you're still playing even, but there's this lingering injury that's going on, maybe there's other forms of things that you can take that aren't cannabis-based so that you're able to sleep, but you're not slowing down the recovery or the healing of that tissue. So it's one piece of a puzzle.
Yeah.
And I think so historically, even when I say historically, like 10 years ago, it wasn't a piece at all, right? Or at least legally and known it wasn't a piece. Maybe players were still using it.
Yeah.
Now in recent years, it's become a piece, but it's been more of the afterthought. Well, none of this stuff is working, so maybe we'll try some cannabis to go to sleep or things of that nature. And we're slowly starting to realize that we have to put it at the forefront of conversations. Now, I'm not saying it's the first line of defense for everything we deal with, but it's a part of what's in our toolbox because maybe it is something that we should consider right from the beginning. Maybe it's something we don't consider at all. And a lot of it's based on the circumstances and that athlete that we're working with one-on-one.
Yeah, and that's a great segue to what I want to talk to you a bit about more was like the role of the athletic trainer here. You talked about the policy stuff and testing and being in charge of that, which we'll touch on shortly here. But from your perspective as an expert in the field, Jeff, what's the appropriate role of the athletic trainer? I mean, you mentioned communication's key, but sometimes an athlete might not want to communicate to those closest with him about this stuff that's, taboo, quote unquote. How should the athletic trainer handle that?
So I think, like almost everything else, the athletic trainer is the central line of communication
Right.
to the athletes for near everything, right? Especially the trust piece, and that's why we have a little delay in here because we just haven't been trusted in this space
Yeah.
because the athlete doesn't trust anybody historically in a space. As this is opening up now, the first role the athlete or the athletic trainer has is to become educated. Learn these things that I'm talking about. Again, it's not a secret that I have. It's easy to translate into others. I've had the opportunity this last year, for example, to speak at the winter meetings to the team's physical therapists and spoke to many other teams and staffs just to become a little bit educated on this space. You probably won't know everything, and there's nothing wrong with that. We don't know everything on all that we deal with, but then extend that education. So work closely with our team physicians, right? Historically, physicians are not favorable to using marijuana of any sorts. And so let's educate our physicians. Let's work together with them. And let's be open-minded to the athlete's circumstances as to why they may want to use this, what they've done in the past. You're going to be working with athletes at the professional level that have not only grown up using marijuana in their life based on where they're from, but they were actually introduced to it by their parents in their own house. And so
Right.
they don't really understand what's bad about it, only because they've been using it forever. And oh, by the way, you drafted them and they're playing the major leagues. So how could it be so bad? And I think what you see is incrementally, we're talking about individuals that have tremendous skill and talent. So the talent and skill alone is going to, and of course, hard work and some luck are going to get them to that level. But the
Yeah.
reality is, each level that you climb, as the competition gets tougher, as the margin of error to win is more difficult, using marijuana makes it harder to perform and excel at those optimal levels as you improve to the major leagues. So the athletic trainer's role is to educate everybody, but educate themselves first, come at it from an angle of non-judgment, and making sure that each person is treated individually. Because as individuals can have a ulnar collateral ligament tear and undergo the Tommy John surgery, but no two of them are exactly the same. They're going
Right.
to heal differently, going to respond differently. And we have to take this knowledge of marijuana and cannabis out of the one size fits all space, which is usually how you start. You have to learn somewhere, but then fine tune it down for the individual athlete that we're working with.
Right. And when it comes to educating themselves, obviously working with someone like yourself would be awesome, if they had access to you. What resources on a basic level, let's say there's a young athletic trainer in college grinding their way through right now, where would they go to learn about this?
Huh. Listen, I'm not going to toot my own horn, but I am.
Sure.
Call me,
That's why we're
call
here.
me,
That's why
call
you're
me,
here.
right? Because here's the truth. I'm sure you know everything on the internet is factual and truthful, right? So this is the problem we have, and this is one space that is as much as anywhere else where you're going to find propaganda like you've never seen before, right? I have
Absolutely.
had the fortune to attend many professional conferences, and in studying cannabis, I've gone to cannabis conferences. You could only imagine going into a cannabis conference, number one, every presentation, every person that attends is 100% pro cannabis. It cures everything. It
Right.
doesn't matter who you are and what your condition is. The second thing, imagine walking through, if you've ever been to a conference, you go to exhibit hall, and the exhibit hall has vendors with, they might have exercise machines and whatever else.
Yeah.
Imagine going through the exhibit hall of a cannabis conference, right?
Yeah. A little
So
different.
what I'm going to share with you is that it's a great learning experience. The internet's awesome, and going to these places in person is great, but you're going to get a biased, one-sided view to learn. And so I am very careful to where I find my information. I have a shared folder with the groups that I work with and consult with. I have a shared folder that I give them access to so they can find the quality presentations that are given, the peer reviewed articles that are really good. Because even the articles that are published are really not well done. They have poor methodology. Like I said earlier, they're harder to study, and they're certainly not studying the populations that we're talking about today. So
Right.
I think what we've learned, the best scenario is reach out to someone who can give you an objective answer in this space. And that answer might be, I don't know. We don't know, unfortunately.
Sure.
But that's how we learn, by communicating with each other and learning this. And so I've made myself available to all teams, all staffs, and not a day goes by where I don't receive some question or inquiry about something. And I don't know everything, but I've learned to realize, like everything else, right? You've heard people say this before: the more I learn, the less I know.
Yeah.
The more I learn, the less I know, and the less I realize others know even as much. And so I think we're in this together. We have to figure it out together. But I'm a resource. I'm always happy to help anyone with questions because they don't know where to turn, right? So if you're a Joe Benj and you've got a professional baseball player who's dealing with an injury and he's also smoking a lot, who do you call? How can you open up
Right.
that conversation and
Right.
trust somebody, right? So I'm happy to help. I think the strength I have is not just the knowledge that I built in this area, but understanding this space, respecting the privacy and trust. I'm not out there saying, "Hey, by the way, I'm in the cannabis consulting space, and these are the players that I work with." Right?
Right.
That's not
Right.
going to come out there. And so I think people know that they can trust me in this space. Allows them to have informal calls with me and discussions about individuals. And many times, to be honest with you, they don't tell me who the player is in the name. I don't need to know it. I just
Mhm.
need to know the circumstances, and we can help guide them through that.
Yeah. Super interesting to hear you talk about that. And, I been listening to you talk and get to know your experience a bit better. And I'm thinking to myself, during this conversation, is Jeff totally 100% pro cannabis? You just talked a little bit about that. How would you kind of rate your standing on that? Obviously, you do this for a living, part of your job. You know so much about it. You've said positives, you've said negatives. where do you fall in? Obviously you can't be like, use this for everything. It's the greatest thing ever.
Yeah, I fall in right where you just said.
Okay.
I'm objective,
Right.
and I believe that cannabis use has therapeutic benefits when used appropriately for the right situations, in the right application, the right dosage, with the right monitoring. And it also has some significant side effects and harm potential
Gotcha.
that range from nausea all the way to psychosis, and in some cases, I'm not totally convinced it's a gateway drug from a chemical perspective. In other words, all of a sudden you reach this point, this isn't giving you the high that you want, so now I've
Hmm.
got to go use cocaine and other things. Does that happen? Certainly. There's individuals that fall into that trap, if you
Yeah.
will. But I think it's more of a gateway drug socially, where people will find that it's a crutch. I feel I need to have this in my hand. I use it every night. Look, I'm a addict to espresso coffee, right? And if I go a day without it, yeah, maybe I'll get a headache, but psychologically, I also just don't feel right. And I
Yeah.
think that's more of the component because, when I was, 30 something years ago in college and people were using marijuana, the way it was, you all go out to a little area in the grass, put a blanket down and, pass something around, smoke together. The majority of the people that I talk to nowadays, especially at the professional level, that's not how it works. It's not a group social function. It's more of a individual. This is how I wind down at the end of a day. Or I've had a single athlete say, well, and I said, well, when are you tempted to use it? And they'll say, well, if I had a really good day, I'll use it to celebrate. And if I have a really bad day, I'll use it to cope. And I say, so is that every day? So there's a rationale. Everybody has different, and I respect their use and try to stay out of their lane of judgment, but try to stay neutral and say, well, the way you're using it, it actually is helpful. I'll be honest with you. Or the way you're using it has risk patterns that could hit your performance or your off-field behaviors, for example. And so I'm very neutral. I'm very objective, and I want to stay that way. It doesn't cure everything. There's no doubt about it. And it doesn't create harm for everyone. And again, you'll hear me go back on a regular basis to use that word individualize.
Yeah.
And I think that's what we do with our athletes. We individualize everything we do to make them a better player.
Right. I think that's been the big takeaway so far for me is there's no one size fits all. Just like rehabbing an arm or anything, like it takes communication, knowing the athlete, individualizing. So very interesting to hear you share that. You did touch on a bit earlier about the drug testing and your issues with that. I do want to come back to that a bit here. In your opinion, have league rules and kind of drug testing policies that we've always heard of, and ESPN breaking news, failed test, this, that, have the stigma around those drug testing and the policies themselves kind of shaped how cannabis is actually viewed and what it can do in a helpful manner?
Yes, I think that when we tested for marijuana in the drug tests, because you can essentially test for all the other cannabinoids. The THC is what we test for specifically.
Hmm.
And whenever we've had a positive test, it's been viewed as a very bad situation for a
Yeah.
person. But cannabis in somebody's system at that high level that failed the test wasn't necessarily a performance enhancer. Is no
Right.
no proof of that, and I
Right.
think that's why we've gotten away from this. And I'm still a fan of testing, but here's the challenge: testing under, for example, professional rules has player protection through collective bargaining agreements,
Hmm.
whereas the staff doesn't know the results or the numbers specifically. My bias towards testing is to use to educate an athlete. So if you're a user and I'm working with you and I say, you know what, here's what I'm finding. You have not been able to put on lean muscle mass in months, and you're busting your tail with the performance staff, and this doesn't make any sense.
Yeah.
Your reaction time is a little slower than it should be, and whatever other metrics we find that aren't where they should be with your talent and potential and your work ethic. So can we get a test? And we can do it through the club. We can do it privately, but let's get a test and see how much THC is in your system. Now, here's what I'm going to ask you to do. I think I can help you. For the next 4 weeks, can we change your pattern of use? Can we decrease how much you're using? Can we change the time you're using it? Can we modify the application mode? And what I'm really shooting for is less that gets in your system and stays in your system over time. And then let's monitor these same metrics that I just referred to. Let's see if you slowly put back on lean muscle mass. Let's see if your vision or your reaction time or these other things improve, your sleep improves. If you see that, then the reason we tested was right on. It gave us a visualization to know that the amount you had in your system was too much, and now we're backing off. The example that I tried to compare this to with everyone, not just athletes, is diabetes, right? So if you come in and see me one day, you walk in a training room and say, hey, Jeff, my God, my toes are tingling. And I notice now I wake up middle of the night and I just have to keep going to the bathroom. And medically, we start thinking, wow, maybe this person's starting to develop prediabetes or diabetes circumstances. So what do? We get lab work and we look at the numbers of what are your blood glucose levels. And if your glucose levels are high, we intervene and we treat that. And so I look at the same thing. What are your THC levels? If your THC levels are X, they don't have to be above or below any random threshold of a drug test. Just what are they? Whatever that X is, it may be too high for what your system can tolerate. So let's try to just decrease that number and retest. It's quite simple, honestly, because you would do the same thing with that diabetic potentially person. You would retest them after you've intervened with something. And so I'm in favor of drug testing, but not from a punitive perspective, not from a gotcha perspective, but a metric perspective. Just like when you come into camp, we measure all these things and we collect all this data, and then we work with you and then we monitor it. And when we get to that point, we do that, we will find that I don't want to say that players will learn how cannabis can be advantageous for them, but they will learn how it will no longer be disadvantageous for them to reach optimal performance.
Yeah, that's a great way to say it. We've talked a bit about that fine line of what's too much and what's not. I kind of want to dive into, again, the policies, but the getting caught perspective. Policies have changed over time. We've seen reduced penalties, thresholds become higher in certain leagues, the elimination of off-season testing in some sports leagues. Are you seeing those policies evolve in the way you'd like them to? And where do you kind of see them headed in the next, near term and long term?
I am seeing the policies evolve in the sense that the gotcha testing is going away, and the penalties are going away. I'm not a fan of penalties because many individuals truly use marijuana as a coping mechanism. They need some guidance, they need some assistance, they need to find better ways to cope. Mm-hmm. What I'm not pleased with is the education. It's lacking in many of these places that have removed policy of punitive approaches, really haven't provided the educational pieces either through the players associations for the athletes or through the teams or through the leagues. And it's not an easy task. And honestly, I think part of it is because there's a lack of expertise at those levels where the decision-making is made to say, let's remove this, but the expertise is not there to then develop and provide the education in a way. It's really simple. There should be some standard general education that's that 35,000 foot above to give you, here's what you need to know as players, here's what you need to know as medical staff, here's what you need to know as management. And then there's here's how we specifically work with players one-on-one. Who's on the team to work with this? Look, if somebody has an injury, there's a team that works with them. The athletic trainers, the team physical therapists, the massage therapists, the strength coaches, the physicians, right? The mental health people, and then ultimately the management is involved with understanding what we're looking at. I think if we take an approach like that to an individual who's using cannabis, where it's impairing their performance, that's what's missing right now. Okay. And again, I'm always happy to help programs develop the knowledge and the guidelines for this. I think that's what's needed. And the more we learn about it, the more we can share information with others. This is really interesting, Sam, because I've had people ask me, and teams that I work with, and they say, is it possible that you would consider, Jeff, not doing what you're doing for everybody anymore and only work with us? Because if it works for us, and we can change the performance and the behaviors of some of our players, it's a competitive advantage for us. Mm-hmm. And what I found, quite frankly, in this space, there's truth to that. And the reality is, I don't know that I've ever met a team that doesn't have players at any sport, any level using. But the medical people are really good about sharing the information in this space right now. Maybe that'll change over time. But I remember one time I had a couple of different athletic trainers from professional sports, and I put them on the podium and I said, hey, if you found like the cure for chronic hamstring injuries today, right? There was something where you just, push this magic button or take this magic pill
Yeah.
and they were better tomorrow. Would you tell? Would you tell your colleagues and the other teams? And there was sort of silence. Nobody would answer the question. Nobody wanted to say, no, I won't tell them. But in this space right now, I think people are really open to sharing the information with others because there's also a component of your job. Let's be honest, right?
Right.
People are being evaluated on time loss injuries. And
Exactly.
so if you have the ability to help colleagues out as well and say, look, we found a solution to this, or at least a way to improve on this and decrease time loss due to marijuana overuse, we need to help each other out in this space.
Yeah, absolutely. Very well said there. I think time lost, as you said, for an athletic trainer, huge. People need to be on the field, and if you can find a way to have Jeff in your building every day and keep players on the field, like that's something that's very enticing for all clubs and any sport. Well, Jeff, kind of as we get toward the end of our conversation here today, the future of cannabis and sports medicine. Right now, is there any like big research or things that you're working on or seeing that you're most excited about in this field?
Yes. And so the work that I do with teams, many of the teams and many of the sports that I work with have tremendous data analysis staffs now.
Mm-hmm.
And we'll sit down together and say, what are you measuring? What's important to you now? And this is what I do. And I'll give them the 5-minute education of the things that marijuana can impair. And let's see if we can track metrics with this. So what we're doing is we're almost working backwards. So because we don't have drug test numbers, which makes it easy to compare, what I'll tell these folks are, here are the common impairments that I will see, right? So you'll see delayed times, as I said, on your first step. You might see inability to track a ball in the lights, either in an indoor stadium or
Okay.
at night. So what I call impairments, the cannabis impairments that are related. And then tell those teams, these are the types of things that we start to wonder when you see symptoms, just like the urinalysis in the middle of the night and the tingling in your feet. When you start to see these symptoms that are related to high cannabis use, let's start tracking those patterns. Those are the players we need to keep our eyes on. And then what we're really working on, Sam, right now, which is probably the hardest part, but should be the easiest, is effective communication. How do you approach that athlete then when you have this information that says, look, everything we're seeing is indicative of high cannabis use? So you're not making an accusation, but an observation without making them uncomfortable and even to the point of being angry. That's the key. That's the key. And all that comes down to relationships. It comes down to you knowing who those players are. It comes down to, again, knowing what I call their baggage. Their baggage is not a negative thing, but again, did they grow up using this? Are they using it to cope? What's the rationale that might be behind this? And so that's the biggest piece we're working on right now. And it's less scientifically driven data as it is more just interpersonal communication effectiveness based on what you're seeing from observational performance.
Right. And that aligns so much with what so many PBATS members and athletic trainers on this show have talked about in the past is kind of that feel for your athlete, for your clubhouse, for your training room, communication. That's at the core of everything. We're human beings. We need to talk to each other. So I think
Yes.
that's really cool to hear you echo that same statement on a much different issue. Well, Jeff, to wrap up today, you shared so much great information. You're educating constantly, as we talked about. Is there one thing for an athletic trainer getting into the field that you wish they would try to better understand about cannabis in sports?
Yeah, just be open-minded. Take 5 minutes, start a conversation, and you'll realize that this impacts the athletes you work with, impacts all the ball players, impacts your ability to do your job, and it impacts the overall decisions that management is making, both for the players and for your job. And so there was a period of time, I'm not going to lie, Sam, where I started doing this and educating it, and nobody would talk to me. They wouldn't respond to my texts or my emails and say, hey, let me share with you what I'm learning. They all thought I was nuts and crazy. What's wrong with this guy? He said it's a great career in sports medicine, and now he's going crazy over marijuana. We've crossed that tipping point now where people are starting to realize if I simply listen and learn what I don't know, there may be an avenue here for us to all improve. So I think it's the biggest message is as early as you can in your career, become open-minded. And
Right.
especially if you're later in your career where there's sometimes a tendency to say, I'm at this point now, I don't need to know it. I'll hire this person on my staff who can do it. But you need to listen and open your eyes because this is a game changer. And, the truth of the matter is two things. One, this was before our eyes forever. We just didn't know what we were seeing and what it was attributed to. But two, there is truth that the strains of cannabis nowadays are significantly different and stronger than they were decades ago. And that's why we're seeing more of these issues creep up into the baseball sport. And so,
Right.
yes, just be open-minded, receptive, and ready to learn.
That's great. And Jeff, let listeners out there, you said, get in touch with you. Where can they find you? Website or, you don't need to share any of your personal information. We'll link everything. But where can people find you and find your work?
Yeah, so listen, I'm going to throw my cell number out there because that's the best way to communicate with me. Right? I'm open to that. Just keep in mind the time zones you're in when you reach
Right.
out. But you can hit me up at 813-525-3192. It's the easiest way to reach out and find me because the people that I work with in this space, right, they want an answer yesterday. So I
Mhm.
get it. If they're reaching out and they need my help, I will do everything I possibly can to get back to them as soon as possible. And then if there's other ways to communicate, we can go from there.
That's great. Jeff, well, we really appreciate you and your time today. I know you're super busy, but such a helpful and useful conversation for PBATS members, for younger athletic trainers, for the many educators who listen to our show. So can't thank you enough for everything you've done for sports medicine, for PBATS, for athletic training, and we'll hope to talk again soon.
Thanks, Sam. It's been fun. Appreciate it.